Dr. Jennifer Crozier of Baptist Health.
Good morning, and thank you so much for having me. So just to highlight, Baptist MD Anderson Cancer Center, and I'm also going to talk a little bit about the work we're doing throughout Baptist Health, especially in regards to precision medicine. So precision medicine is also known as personalized medicine, and throughout Baptist Health, we're working to integrate our care across all disease sites and really individualize care plans. And we're doing that through prevention, diagnosis, and treatment aspects. So for prevention, we're looking to individualize care based on a patient's history, their personal history, their habits, their family history, but also their DNA testing, and deciding what screening tests they need, what blood work they need, what imaging they need. And then for diagnosis, we're using the latest in radiology and pathology techniques to be more specific in our diagnosis. And that helps us with treatment, right? If we have a good diagnosis, then our treatment options are more specific and accurate. So as far as treatment, also in the world of kind of cardiology, endocrinology within Baptist, we're utilizing something called pharmacogenomics. So being very specific with patients about which medications they would benefit from the best. So really cool work throughout the organization. So I want to highlight genomic testing today, and we'll talk about some clinical trials. So genomic testing, what is that? So genomics is genetic testing on patients' tumors. That can be done on biopsies or the tumor once it's actually removed from the body. And I'm a breast medical oncologist, and this is used every day in our decisions about what treatments patients should have. For patients with curable disease for breast cancer, that's stages 1, 2, and 3, when we catch a little bit earlier, we're able to help decide about chemotherapy with this technology. So analyzing the DNA on the patient's tumor and tell them if they need chemotherapy or not. So we've been giving less and less chemotherapy over the years, still with a great survival benefit in patients with breast cancer. In patients with stage 4 breast cancer, right, that's where it's spread throughout the body, it is not curable, but it is still very treatable. We're able to give specific treatment recommendations just from a blood test of the patient's tumor DNA and looking at that and telling them which drugs are going to work specifically for them. So really a completely changing world. So FLEX is one of our ongoing research studies. It's the largest genomic research project in the world for breast cancer. We're looking at what we call whole genome sequencing. So we're sequencing breast tumors, doing 22,000 genes, something that used to take us months, now takes us just a day or two. Looking at all these genes and then pairing that with clinical information about patients, so over 800 data points about the patient. With that information, especially across the world, we're able to learn more about smaller groups of patients, right? Where somebody may only see 1 or 2 patients with a certain type of breast cancer and different data points about their history. Now you're able to pair that across the country and look at this more closely across all these patients. And it's really led to different research projects throughout the country with different groups collaborating, which has been excellent. So it's a large real-world data set. We're discovering novel genomic profiles of patients, which is going to lead to more precise treatments, not one size fits all, but exactly what that patient specifically needs, and hopefully less and less and more specific treatments. It started in April of 2017. The original goal we had was 10,000 patients. That's up to 30, maybe 35,000 patients now as we just passed 10,000 patients, and it's been so successful. We were luckily an early adopter of this, and we have been the largest contributor to this study worldwide. So novel therapy. So in addition to genomics, getting better diagnosis and deciding what treatments we need those new and novel treatments. We're always trying to target different things on the cancer cell that are specific, right? So we don't want to have damage to our normal cells like chemotherapy can do. So we're looking at new therapies targeting mutations, so something wrong in the DNA, or what we call a receptor, like a little radio antenna that hangs off of the breast cancer cell, targeting that specifically. But we have to find those targets and then develop the medications for them. We also like to assist the immune system, right? We have our own immune system. Can this battle cancer for us? And the answer is yes. And it's been very successful in disease sites outside of breast cancer, right? Revolutionary melanoma, lung cancer. But in breast cancer, we've had trouble finding the population of patients for which the immunotherapy works. So we want to tell the body's immune system, go and kill these cancer cells. So we're looking at this in the Keynote 756 clinical trial. Our goal is, of course, to prevent disease recurrence in these patients with breast cancer and improve their survival. And we're hopeful that this will identify the group of patients with a little bit higher risk breast cancer that will benefit from this therapy. Once again, we're trying to give less and less chemotherapy. The next trial I wanted to highlight is our Cytomex trial. So while patients with breast cancer overall are doing better and better each year, there are high-risk patients. There's patients that, unfortunately, their survival is only 2 years if they have a very aggressive type of breast cancer. So we're looking at that group specifically in this trial, and we're looking at 2 novel therapies. So a novel immunotherapy, so another way of harnessing the immune system, as well as a new targeted therapy that's never been used before. We were lucky enough to have the first patient to have both of these medications given together. It's a little bit of a nerve-wracking day, but everything went well, and both of those drugs are being evaluated. So we're hopeful for improvement in survival with this combination therapy, and lots of opportunity for development there. I do want to highlight our neuro-oncology program that is led by Dr. Rob Cavalieri, a neuro-oncologist. He is doing just innovative work with oncolytic viruses, where we're actually giving these viruses directly into brain tumors. He's collaborating with Duke and Dana-Farber in Boston on these trials. The other thing he's doing, which he's going to have a first-in-human study where we're going to use a new device to cross the blood-brain barrier. So our blood-brain barrier is there to try to protect the brain from infection, cancer, anything from getting there. The problem is when cancer does get there, how do we get our medications there? So he's looking at a novel device. It's going to be a pump that's going to be implanted and giving the medications directly into the brain tumor. So really exciting work from him. So just in summary, just to highlight our breast cancer research program, within the last 5 years, we had no clinical trials. We've grown. We've had over 25 clinical trials. We currently have 16 open trials. We're about to enroll our 1,000th patient on these trials. We continue to be the top international enroller to 6 of these studies that we currently have open. We continue to present and publish internationally. So a very exciting time. I'll be happy to answer questions after the program, and thank you for having me.